What's up guys, we're gonna go over blood flow restriction training following ACL reconstruction surgery. I'm gonna show you 2 exercises that I like to use following ACL surgery. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist. Let's jump into it. All right guys, so we got BFR, we have the Owens Recovery Science System here. So what's gonna happen here is this cuff here is applying pressure on my leg to decrease venous flow. So I'm gonna be working out at around 30% here. So all I need to get is 30% of my weight, but I'm gonna go body weight to do these exercises with some resistance. So I'm gonna show you a little superset combo that I really like to use with our athletes at the end of our sessions. And I really like this because it's gonna really target the quad, really get some good volume and get a good pump in the quad after ACL surgery. And as they're going into these phases where we might not have as much time to really get into some quality weight training because we're doing more movement, so we finish it off with this exercise. So the first exercise is gonna be the rear foot split squat. So we're gonna get in this position, like I said, because we're using BFR, we don't need to have as much weight because this is gonna give us the stimulus because it decreases the blood flow to think that we're lifting heavier weight. So here, we're gonna really force our knee to go past our toes and really go more quad dominant. We're gonna go 30 reps on this. And when we do this exercise, we're really focusing on keeping the heel down, pushing the knee towards our toes, driving off, getting a good pump there, nice and slow, controlled, and really have all our weight in this front leg. And when I'm doing this exercise, I usually don't want to have people with this back leg to push off the back leg. You shouldn't feel anything on the back leg. Maybe a tiny little stretch, but nothing besides that. So once we hit 30 reps, then we're gonna superset this. We usually hit 30 reps or near fatigue. Then we're gonna superset it with a knee extension. So normally I'll grab a knee extension band here, set it up. You can use a machine at the gym. I usually tell people in the clinic or wherever you're doing it, if you have some BFR at home, set up a chair, put a strength band here. And then once you do the Bulgarian split squat, because the Bulgarian split squat gets quad, but it also gets hamstring glutes, I really wanna tax out the quads, and this is gonna be the way to really finish off and burn the set here. So I'm gonna have the resistance band, I'm gonna kick out, and this is probably the most important exercise you can do to really target the quad. The reason we do this exercise is because there's only one muscle that can extend your leg, and that is the quadricep muscle. Because the Bulgarian split squat, we are gonna feel a good pump in our quad. However, this is the only exercise that really targets and isolates the quad. And after ACL surgery, majority of the time people get patellar tendon graft or quad tendon graft. The quad gets very weak, and this is a good way to really target the quad. And as long as you're past 6 to 8 weeks, it is safe to do this exercise. Early on, it's not recommended. We usually wait at least 8 weeks. Then you can start adding in some resistance on this exercise. But I'm pretty much going this exercise after I do the rear foot split squat until absolute failure, until I can't anymore. And the reason I wanna do that is I wanna get that good quad pump. This is gonna allow us to really target the quad at a low load, high reps, and really get that knee condition. But those are the 2 exercises that I like to use superset with BFR. Like I said, we use BFR a lot in our ACL rehab. It helps, it has a pain an analgesic effect where it helps decrease pain. And it's also just gonna allow us to train and put less load on our joint. A lot of people that have meniscus issues or anything like that, it's in a good way to really target the muscles without putting stress on the joint there. And we don't need that much weight. We need 20 to 30% of our normal load. I just go body weight on the split squat, and then I have them finish it off with a strength band. And the big thing is make sure the athlete hits failure whenever it comes to these exercises. So if you guys have any questions regarding BFR with ACL rehab, comment below. Let us know what your questions are. We'll shoot some videos on it. If you like this video, hit the like button, share this video with friends and family. We are the Basketball Doctors. Let's ball for life.